So, welcome to the first episode of Health Issues India webinar. I'm very excited to have this dialogue with our esteemed experts today. The webinar is particularly special as we commemorate the World Cancer Day on 4th of February. The theme for World Cancer Day 2025 to 2027 is United by Unique. Such a beautiful theme because it highlights the importance of personalized and compassionate care, which is often, overlooked, recognizing that every individual has unique needs, stories, and perspectives to tell. This day provides a timely opportunity to not only reflect on the challenges that persist, but more importantly, outline what's needed to move from discussion to the real life implementation and scale up action to address the current cancer care gap. We have innovations, we have treatments that are coming in, but what lies within, what goes on in a patient's mind is something that still needs to be addressed. When we were talking to Ratul, we heard a very important thing that, compassionate care in cancer is something which is most important, but it is most ignored. So, our webinar, Redefining Cancer Care Innovations with Empathy and Compassion, aims to delve into multiple perspectives of cancer care and the need for empathy based interventions. As we gather to gain valuable insights into the evolving landscape of cancer care, we are honored to be joined by three distinguished experts who bring a wealth of knowledge and experience to our discussion. First, I'm pleased to welcome Dr. Prasad Kasbekar, who is an award winning consultant surgical oncologist with special interest in head and neck, breast, and gynecological cancers. He has completed MCH in surgical oncology from the Gujarat Cancer and Research Institute and did a fellowship in advanced head and neck cancer surgery from South Korea. Currently, he is visiting consultant in multiple hospitals in Mumbai, such as Breach Candy, Sefi Hospital, Wockhardt Hospital, and many more. To date, Dr. Prasad has performed more than 5,000 independent cancer surgeries. And he is one of the pioneers in using artificial intelligence and 3D planning in cancer surgeries. Welcome, Dr. Prasad. We are really delighted to have you here. We are also privileged to have Mr. Ratul Lahiri, who is the CEO and founder of Purple Ribbon. It is a startup healthcare venture into oncology, home care, and chemo day care with the objective to make quality cancer care accessible, affordable, and at the doorstep. Purple Ribbon has partnered with 10 nursing homes, 7 in Mumbai and 3 in Bengaluru. They have a team of over 20 oncologists and have served over 1,000 patients. They cater to every segment of the society, irrespective of the economic background. They provide holistic cancer care from OPD consultation, diagnostics, chemotherapy, and surgery to nutrition and psychological counseling and home care. Welcome, Ratul. We are really delighted to have you here on the panel with us. And lastly, I'm delighted to welcome Ma'am Jayashree Ratan, who is the founder of Saaisha India Foundation, a charitable organization founded in 2018. She's been doing an amazing piece of work since 2018, about which you will get to know more during this panel. Saaisha provides free knitted and crocheted breast prosthesis made of 100% cotton yarn to women who have undergone mastectomy. They also provide free cotton beanie caps to children undergoing cancer treatment. The organization has over 400 volunteers spread over 5 countries. So far, they have helped 23,000 patients, which is beautiful. Welcome, ma'am, and welcome all of you. We look forward to having a great discussion.
Thank you.
Thank you so much.
Thank you so much.
Great. Great. So, without further delay, let me start with my first question, which is addressed to all of you panelists. This is something that we all have observed, unfortunate, but we all have a cancer story, in our family or extended families. It is unfortunate, but we do know that, when someone is diagnosed with cancer, the immediate response, there's a lot that's going on. The immediate response is, why me? Then it moves into denial, then it moves into very, very slow acceptance. So, what the family members really look at is recovery. They look at treatment, but what gets missed is what is happening in between. What the patient is thinking. How is he reacting to this big change? That in his life there is a lot of fear. There is a lot of nervousness. There are a lot of doubts that needs to be addressed and taken care of. So I would like to, talk to all of you panelists about that. What is this compassionate care? What are the trends in the current cancer scenario that are existing, and what are the gaps in, say, mental health support, consultations, holistic care that each one of you may have a role to play and must be observing, by different cancer patients that you are consulting to. So maybe we'll start with Dr. Prasad. What do you have to say about this need for compassionate and empathy in cancer care?
So good day to everyone over here, and thank you for having me on this panel. So I think this is a very good initiative taken by you all over spreading awareness about cancer. One of the prima facie things I would like to say about cancer is I feel there is a big stigma in cancer care. So it is like, for example, if someone is diagnosed with diabetes or maybe heart disease, the kind of response as compared to someone being diagnosed with cancer is very different. So, in according to me, cancer as such is very similar to diabetes or blood pressure. People get complications in diabetes and heart disease as well. Similarly, people in cancer have their complications and their problems. According to me, our society, the results in cancer care are lacking, or they are not, as good as maybe in certain countries abroad because of, according to me, four main reasons. Number one would be early diagnosis. So there's a lot of emphasis on catching the disease early, which in India is lacking because people don't want to admit it, or people are not willing to go and get themselves screened or checked. Number two, which is a major problem in our country, is the cost of treatment. So a lot of people don't know their budgeting upfront. They don't know the level of care that they need. They don't know whether they'll be needing surgery, chemo, radiation. They tend to spend their resources, at wrong places during the treatment. This is my personal experience, whereby later they suddenly run out of money, and then their treatment gets hampered because of that. So budgeting, knowing the costs of your treatment, and wherever you may take it, whether it's in uh, a big hospital or whether you take it in a trust, whatever, but you should know your costs and the sort of treatments needed. Number three is your time towards treatment. So time towards treatment is many times, when you're diagnosed with cancer, there are set protocols that your treatment should happen in a certain time frame. Many patients, especially patients going to the bigger hospitals like Tata Memorial, they cannot adhere to these time of treatment guidelines because of the sheer load of patients and the sheer the sort of stages that they come in. So on that basis, the time of treatment has sort of effect on the outcome of treatment as well. And number four is rehabilitation. So people just associate cancer care with surgery, chemotherapy, and radiation. People don't associate it with the rehabilitation aspect, that aftercare, how you can get back to a normal life. I would say medicine in cancer has progressed to a very large extent, to the extent that many people are now even surviving 10 years, 15 years, or even more after being diagnosed with cancer. So it is not a death sentence, cancer, that people should understand that you just have to accept the diagnosis, and you have to place your trust in the doctors that are treating you and just move ahead with your treatment. So towards that, the in abroad especially, the end point is sort of slowly moving away from just survival towards quality of life. So we're not focusing only on ensuring that the patient lives 10 years, 15 years, or whatever years, but we are also trying to work towards ensuring that the patient has an absolutely normal life. So
Yeah.
hence, there's a lot of, we have to work towards moving this stigma away from cancer, that cancer is something bad. It is your life's over if you have cancer. And we have to move towards, not only treating the people, but ensuring their quality of life is maintained. So I feel there are lot of lacunae in healthcare treatment in India when it comes to these aspects.
Yeah. No, I think it's a beautiful, statement that you made, that cancer is not the death sentence. I think half the journey is one, if we have that faith in the fact that, cancer, my life will not end with cancer. And also, like you rightly said, that they need to trust the doctors, they need to plan the treatment well. And for that, having a stability in mind and, having that confidence is very important, wherein this compassion and empathy really comes into being. Jayashree ma'am, I will come to you because Dr. Prasad, really mentioned about
Yeah.
that, the quality of life, right? And I think you are playing a very important role for the survivors also. So if you could talk about a little bit about this whole compassion and empathy bit, and also how you are ensuring that in your own right. We could see that even before the panel started, that you do not answer any calls. So I think that in fact it's a very good way of responding to the survivor all the time. So please talk about it.
Just yeah, thank you very much. Yeah, this thing is, as doctor was saying, I did realize what he said was very, because I have faced this same issue with patients who call me up for a prosthesis, and it is there. I mean, the fact I always tell them, I think cancer is far better than diabetes, because cancer is curable at the right stage. Diabetes never gets cured. Once you're stuck with diabetes, it kills every part of your body, your eyes, your senses, your nose, your everything goes. Your kidneys, your liver, everything gets damaged. So I think cancer is a more curable disease than diabetes. That's what I tell patients who are calling me up. And just as you would take care of diabetes and hypertension, this is something you need to go in early. It's very true. Screening is very important. Uh, it's, as he says, even amongst my volunteers, I have to persuade everyone above 40 to go for their first screening. They don't do it. So volunteers are making these knockers for the cancer patients, and they do not realize the importance of getting themselves screened first. So screening is something we need to teach the population that cancer is curable and it is not a taboo. It's become a very much of a taboo. What we are providing them is, once they have a mastectomy, we find that nobody ever asks them what they are going to do. I mean, it is not, I'm sure it is not the surgeons, oncologists, to ask them, what are you going to do after surgery? No. Nobody even bothers to even think of them and ask them, what are you going to do? There's no option. And this is not it was not there in the market. So we brought it in 6 years ago. And I had to create awareness amongst the doctors that this is available for free. I had a lot of tough questions to be answered, but I said, this is not mandatory for anybody to take from us. You're free to use it or not use it, is your choice. And over the years, I found that our having given this, many have got back to us to say that life has certainly improved for them. Some of them haven't gone out of the house for more than a year or 2 years after treatment, after surgery, because they didn't know how would they will look outside. They felt very incomplete. What we are giving them is more a psychological and emotional support. And the fact that they can look normal again by go out, nobody will even know that you had surgery. So that is what we are trying to do, and I think we have successfully. I have to show you this in between, because later on I don't. Oh, this yeah, this is something. This is a crocheted one. I'm sorry.
We can
The
see.
gray is a crocheted one, and the white is the crocheted one. Gray is a knitted one. This is what we provide free, and we also call them huggable. If somebody is using this, suppose a breast has been removed and she has inserted this in a bra, in the regular bra, and you hug the person, you won't even know that you're missing one.
Yeah.
This is a feedback I got from one of the patients. She said, Jayashree, something wonderful happened today. I said, what happened? She said, this is huggable. I said, what do you mean by huggable? She says, somebody gave me a hug, and then, I felt very normal. And it was her friend, a very close friend of hers. She said, but
Yeah.
you told me you had surgery. What happened? How it doesn't look like it. She says, that is what I have replaced in place of surgery. I mean, after surgery, this is what I got. So And, immediately she called me up to say that she was so happy that this happened. And that is the feedback I look for from everyone. The satisfaction and the happiness that they get, that they are normal again and they don't feel like a broken person.
Yeah, yeah. No, I
Yes.
think that's a beautiful contribution that you are doing. I would come to Ratul now, and ask you for any remarks on the fact that how compassion and empathy can play a role to give that comfort level to a patient from the very beginning of his cancer treatment journey and through the journey.
Yep. Thank you, Ritika. I think very, very valuable learnings and pointers I got to know from Dr. Prasad and Jayashree ma'am. Uh, so I think I'll share my experience and two bits from my learning of dealing with cancer patients and setting up Purple Ribbon since last 5 years now. So I think the first thing what you asked in the very beginning, that people will first question that comes to their mind is, why me? uh, Honestly, the kind of patients that I come across, and mostly we get patients who are from the lower middle income population. Okay, and largely the people who get cancer, let oral cancer, or head and neck. These are typically the bread earners of the family. Okay, so the first question that comes to their mind is कि अब family का क्या होगा?
क्या होगा? हम्म.
And so
हम्म.
they don't think that मेरे को क्यों हुआ, so they will think that अभी what will happen to the family, what will happen to my shop business that I have been running, and they're largely shop owners, small shop owners, auto walas and all. Okay.
हम्म.
The second point that I come across as a question is that family को बताऊं कैसे?
Yeah.
So, and I was sharing with you, Ritika, yesterday when we were chatting, like, there are people who, and from a well-to-do family, not well-to-do, like middle-class family. His son is in class 10th, got detected with cancer, or, oral cancer. And he was not wanting to go ahead with the treatment, like surgery suggested, followed by chemotherapy. But he's thinking, if I do it now, my son's exam will get impacted. Okay, so can we do it next year? Exam हो जाने दो, उसके बाद करते हैं. And these are the most difficult thing, I guess, for for us to convince the patient that you can't delay it. And as Dr. Prasad said rightly, a lot of it are curable if you're treating it at the right time. I think a very interesting statistics I like to share here. सबको इंडिया में, I think there is the cancer, the C word is such, a डरावना word, that people think that हुआ तो then it is leading to death finally,
Yeah.
so.
Yeah.
And if you look at the statistics, cancer is not even the top three reasons of death in India. Okay, so the
Mm.
top three reasons are like cardiovascular disease, respiratory disease, tuberculosis. Not even cancer. Cancer doesn't fall in the top three reasons of death in India. Okay, people don't scare. They are not afraid of eating outside. कि अच्छा, cholesterol बढ़ेगा, cardiovascular disease होगा. People are not living
Right.
smoking. कि अच्छा, respiratory issues है,
Yeah.
उसमें death. I think the entire narrative in India is about cancer is very negative, and that's what I would like to share later, my
Yeah.
views. But I think then coming to the next part of it, which I think is very close to my entire mission, is the empathy factor. I think in any hospital, the skewness of supply demand is so strong because there are very less number of doctors, and the patients are huge in number, and largely they're coming from small towns. 70-80% of the cancer population are from tier 2, tier 3 towns. And what happens is that, the doctors, and I know typically in any of the, big hospitals, the doctors who are practicing, they literally have like patients lining up outside. I've gone to government hospitals like Kidwai and Tata. वहां पे तो मतलब चार पांच
बहुत.
पेशेंट केबिन के अंदर ही खड़े हैं. And the
Mm.
doctor is, doing a OPD consultation. There are 5, 7 other patients.
Yeah.
उनके family members are standing inside the OPD cabin of the doctor, right?
Yeah.
So I think there is hardly any bandwidth left of the system to show empathy. They are just busy. मतलब
Correct.
basic treatment हो जाए उतना ही काफी है. Now, there are, uh, I think the softer things are completely missed out. The patient
Yes.
would need diet counseling. The patient would need psychological counseling. These kind of a things. Half of 40% of the patient drop out of the treatment. Okay, maybe of various reasons, financial reasons, traveling issues, and all. But 40% of the cancer patient drop out of the treatment.
Hmm. Yeah,
So
and
I
also
think and hospitals, all hospitals are equipped with, yeah. So I think, hospitals have diet counselors, hospitals have onco-psychological, psycho-onco counselors. But when I'm talking to these psycho-onco counselors who are sitting in the hospitals, they say, sir, हमारे पास patient नहीं आते. But
Hmm.
मतलब इनको जरूरत है, but and as Dr. Prasad rightly said, it's a stigma. When you speak to
The
any,
stigma.
and I tried speaking and convincing some of the people that I know that needed, desperately I thought that they would need a counseling. Okay. This again, नहीं, counselor के पास नहीं जाना. Somewhere it feels, the another thing is that, that now even if you look at the mental wellness, the domain that is coming up gradually, and I know some startup founders who are working in the mental wellness space. Unfortunately, they are now looking at US and Singapore as a market and not in India because it's not yet ready. Because somewhere we feel that mental wellness is still a stigma. कि कैसे बताएंगे कि I am suffering from something that it is depression and all. So cancer takes the front runner in that, in the mental wellness
The
side of it.
negative, yeah, and the negative narrative, like you very rightly
Exactly. I
said.
think
I
it's an
think
extremely negative narrative which is flowing through the society. I think I don't know how to change it. And as I said, that it is completely curable. If you look at, and US stats, 70% of the cancer population survive beyond 5 years. In India, it is 30%, just the opposite. Okay.
mm,
And it's just because detection nahi hota, people not come to camps. I mean, I have tried conducting camps, for Group D staff or government employees, breast cancer screening camp. I know there was no one there in the first day. There were just two ladies who came for that breast cancer screening camp. Then that NGO who was organizing it, they said, "Ki, sir, give us 2-3 days more and then we'll organize." You know what they did? They went out to the schools and colleges of that BMC, Mumbai Municipal Corporation, and जहाँ पे उनके बच्चे पढ़ते हैं, they drove it to the kids कि आपके मम्मी को लेके आओ.
yeah,
And so I think there
I
is
was just going to say this because you have to educate the younger generation. It's only then that this will improve.
yeah.
and then after 4 days they called me up, sir,
Actually,
can you
full
do a camp
circle.
tomorrow?
Yeah.
Yeah, so they called me up, the next day, say, कल आप परसों camp कर सकते हैं क्या? I said, yeah, of course I can do it. And imagine, the next day when I went for that camp with my team and all, there were like 100 women and with their school going kids.
Mm, yeah. No, that's an important point that you shared. And I think now that we are coming to that, how the role that apart from the patient, the family members, the friends, the circle can play is also very important. So there are certain
It
decisions
is a
that have,
holistic, if we say there's a holistic care, you also need to take care a holistic approach, how to
yes,
handle a patient. You can't just
Yeah,
talk to the patient alone.
yes,
talk to the
absolutely.
family and
Yeah, so I think the education needs to happen on various aspects. So maybe I'll come to Dr. Prasad. When we were talking yesterday, I think this is one point that you made, and many people don't know is where how do we, because you said that having faith in the doctor is very important. So when you are selecting a doctor, what are the criterias that need to be met, are also very important because sometimes, patients are in the habit of taking multiple opinions and, not
they
land
get
anywhere.
confused.
So, yeah, they get confused. So, if you could throw some light on that, Dr. Prasad, I think that was a very, very important education, that can happen at this forum. And also, apart from that, what are the patients actually seeking? Because when you speak to the patients as an oncologist, there are certain aspects that will come to your forth that, okay, my patients are seeking this when they're looking at the treatment. So, what are the patients seeking and how should they choose their doctor so that they can have complete faith in the doctor and follow what the doctor is advising through the cancer journey?
So when it comes to selecting a doctor for your cancer care, so cancer is now a very scientific field. There's a lot of research happening in it. There is a lot of work day by day happening in this cancer spectrum. So one of the important ways as a layman, if you want to decide who your doctor is look at their qualifications. So I'm not saying people without the qualifications may not be trained in cancer, but as a layman, if you want to know whether this doctor is trained in cancer treatment or not, is look for the degree of either MCH if he's a surgical oncologist or DM as a medical oncologist. So this means that that doctor is trained by the board, he is government certified, and he's capable of managing these cancer patients. There might be a few senior doctors without these qualifications because these qualifications are relatively new, maybe 20, 25 years old, these qualifications. But it just shows that that doctor is part of a cancer treating spectrum. So he's a part of communities like for example, I'm a member of the ASCO, I'm a member of SO. These are all societies, ISO. So these are all societies which are made up of cancer specialists and where continuous discussion on cancer treatments, on the latest advancements, and everything keeps occurring. So on
Absolutely.
that basis, what happens is that is a first way of putting trust. A problem with cancer in our society is that it is like unlike maybe neurosurgery or cardiac surgery, it is still a open, free for all kind of a field where many people who are may not be trained in it adequately are still claiming that they could treat this disease and they can do it. There's no guidelines in that terms. So many people, I get a lot of patients who have gone to other doctors and then come to me with complications or with this thing. For example, I'll give you another thing. Rehabilitation starts at day one. It does not start after your treatments are over. Your planning should be done the day you come to me as a patient. I should tell you not only in terms of how I'm going to cure you of your disease, but how I'm going to make you normal again and live a proper life. So on that basis, many patients who come have done all their treatments at various places, and then they come in a state where we can't really do much for them. Even madam who's on the panel might be having experience with such patients. But the thing is, today cancer care has really progressed in a very big way, and people should be aware of these things. Like, for example, 3D planning and 3D AI based reconstructions and all, especially in mouth cancers. In India, there's a very big lacuna for that. People don't know that you can give them teeth again, they can eat again. If you go to many of these hospitals, you will find patients with the tube in their nose or the tube in their throat, which can be avoided in quite a lot of cases. So, on that basis, a good way of deciphering it is just looking at the qualifications of that doctor because that cannot lie. Maybe, the doctor might be trained. There might be a lot of doctors who are good cancer surgeons or cancer specialists without the qualifications, but you can't hold it as a dictum. So I would say that is one way. What patients come and look from me. So I've realized, see, cancer is a sweet as well as a bitter pill to swallow. You have to be made aware about what realistic expectations we can expect from a patient. Every patient may not be curable, especially those who come in stage 3 and stage 4 of their disease.
Before.
So that is one, many patients I've realized are not willing to swallow that bitter pill. Obviously, many times we don't counsel the patient because of the psychological impact of treatment, but we do counsel the relatives and everything of
Yeah.
their treatments and
Mm.
what we can really expect in that disease. But one thing I'll put as an anecdote in this is that many of my patients I've realized that their mental status during treatment has a very big impact in their outcomes. So those kind of patients who are very positive, who are willing to trust and who are willing to follow the treatment guidelines given to them, these patients do
You
excellent
get
in
the
their
answer.
treatment as compared to those who
Yeah.
are sort of nihilistic that mera sab khatam ho gaya, or the types who don't have trust, want to take 10 opinions from 10 different places, then make a full
Yeah.
as a word khichdi of their treatment because everyone
Yeah.
has told them a different thing to do you know so these kind of
Yeah.
patients
Very true.
end up messing up, kind of a thing. So I'll give you a small story of mine. There was a patient 10 years back that I had operated. So he had throat cancer and it was quite advanced. He himself was an IAS officer. He had a young daughter, and her daughter was, I think, 15 or 16 or whatever. I don't remember her exact age. But he had gone to multiple hospitals. This is when I was in Ahmedabad. He had gone to multiple hospitals over there, private, and all of them had sort of told him that nothing much is possible. He has around 6 to 8 months to live. When he came to us at GCRI that time, we sort of said that let us give an attempt at surgery and treatment and everything. We explained the prognosis to him. We told him it's looking grim, but we can give you that chance. So he sort of went to his some spiritual leader. That leader said, "Don't worry, you're going to do excellent. You go and do the treatment." And he came back to us. So we did his surgery and everything. He took his radiation and chemo and whatever after his surgery. that same person who had maybe 6 months to live ended up surviving for 8 or 9 years. His basic wish was he wanted to get his daughter married. He's this thing. His only daughter. He didn't want to, leave the family. He managed to do that, and eventually, actually, he did succumb. But the thought process is his positivity, his way of taking the disease that I will fight it.
Determination. Yeah.
Use this thing. It does make a difference, and I do believe in that a very big way. Nobody is
Yeah.
God over here. Everyone is a doctor and whoever, and
Yeah.
they're just trying to do their treatments. But the patient, the way he can tackles his disease, makes a very big difference in the outcomes.
Yes, yes. No, I think that's a beautiful, insight here, that the patient himself, needs to be very positive, and that of course comes through the entire what is happening in the ecosystem, how the relatives are supporting him, how the doctors are, enabling to give him that faith, and of course the inner, how he is, as a person. So I think that's an important insight here. I'll come to you.
I have one
Yes,
second.
yes,
Ritika, I
please,
have
please,
one anecdote connected with what
please,
you were
please.
saying. As the
Yes,
doctor says, uh, I'm very happy that Dr. Prasad is able to give the time to his patients to explain things. That does not happen generally because, as he said, there's a lot of people waiting for him. I understand all that. I got a request for a knocker from, uh, first thing, whenever a man calls me and asks for the request, or a young child calls me up and asks for the mother, it may be a boy or a girl, it doesn't matter. I appreciate the fact that they have taken the time to do this for them, for the mother or the wife. And
agree.
especially if it's a young child, I do that. The only question they can't answer for me is the bra size. When I
Hmm.
tell them, this, you give it to your mom, I will talk to her. I appreciate the fact that boys, when they call, I do tell them, thank you so much for having called on behalf of your mother. Please continue to take care of her. She will not talk to you, but you need to talk to her. There was one case, one gentleman rang me up for his wife. And he wanted knockers. He was going through treatment and all that. I said, okay, I'll send it to you, but you can only use it after the doctor advises you that surgery is over and she's okay to use. You don't use it in between. We generally don't send it before 6 to 8 weeks of surgery. We tell them no, you can't use it. But then I got another call. I sent him a pair, and then I got another call after about a week or 10 days. He said, thank you very much. I've received the piece. They're very nice, and I have a question. Can you please talk to my wife? I said, why? What has happened? She's refusing to go ahead with chemotherapy. What is the reason? She says she will lose her hair. I said, but there are a lot. You please talk to the doctor. The doctor will advise you. Not everybody loses their hair. There are a lot of different types of chemo that they are doing. See, I'm not medically qualified. I can't say that. But I'm sure there is some method. And even if she loses the hair, it's going to grow back in about a year's time. Once the chemotherapy treatment is over, it will start to grow back. He says, no, she refuses to go and she has to go for the chemo on coming Wednesday. This guy called me around about Thursday or Friday. Then I asked him, how many people are you in the house? He said, me and my two sons. And what are they doing? They're both working. They're all at home. I said, come this weekend. All three of you will go and shave your head. All of you will shave your hair. Come back. And then now you tell her to go for the treatment. Because she will see everybody is bald in the head, the hair. So she won't feel bad. And believe it or not, this gentleman has done it. And he calls me up, then following, it was a Wednesday, she had to go. He calls me up on Thursday and says, thank you so much, madam. My wife started her treatment from yesterday. And we all have shaved our head. And she's now okay with seeing all of us with no hair. So we won't laugh at her. So it is something that this is, I mean, the family has to be involved. Without the family, nothing can happen. This is
Yes.
very important.
Yes, yes. No, amazing story, and really, really glad that the husband and the sons, they agreed to do so.
Yeah.
I think that requires a lot of strength, and there must be a lot of love there. So, really happy to hear that. Now I think like we are all sharing stories here. I think it's great to do that. And Ratul, when we were talking yesterday, you told us that you interact with a lot of patients while closing closely working with nursing homes and hospitals, right? And from your experience, what would you say are the biggest challenges that these patients face, and how can we create a better support system to help them through their journey? Like you were mentioning that even in one of the biggest hospitals, there was no much challenge that the patient was facing, but it was more of that there is a lot of waiting, simply because cancer is a highly resource intensive disease area to be taken care of, especially in a country like India. Also, once you interact with all these patients, what are the learnings that you apply to come up with certain successful models or strategies? Because you did mention about some of these collaborations that you have implemented or are looking to implement. So why don't you talk to us about those?
Sure, Ritika, I would be very, very happy to share that. So I think, the way we operate is that we partner with small nursing homes, and that's where we call it like we want to make it affordable and accessible. So we want to come as close to the patient's place. The larger objective and the mission is that can we create, a daycare center in every district of the country. Uh, Fortunately, I mean, I'll just, for the sake of knowledge, everyone here, the budget is on the process now. And the finance minister just announced that there will be a cancer daycare, chemo daycare center in every district. So she just announced like an hour, half an hour back. Uh, so I think there's like in the morning session itself, they started talking about cancer is shows the kind of emphasis the government is giving also. But what I experience is that in the, we get a lot of, as I said, that my target audience are the lower middle income population who are looking at, getting the right treatment, quality treatment, but at a lower rate, affordable cost. And when you ask Dr. Prasad that what is the reason of, people looking for a second opinion or an alternate option, I think one key factor is the cost. They largely go to when I basically come across patients who have gone to a large corporate hospital, and the other slightly a worrisome fact in India that even in tier one city, the average medical insurance or medical cover of a person is 2.5 lakh rupees. Okay. And the coverage itself is like in a tier one city, the medical cover percentage of people covered in insurance is like 38%. If you go pan India, it is even lower. So, but now, of course, with Ayushman Bharat and a lot of the state-run schemes, it is there, but their limits are pretty less. I don't think it is adequate to cover a treatment like cancer. But coming back to the point, I think what I see that when patients come, for treatment, see treatment तो उनको मिल ही रहा है, whether they go to a large corporate hospital or they come to my facility. What is important, very, very important, is to stand next to them as a friend or a family member. Because उसकी जो family होती है ना, वो भी they are more stressed out.
Yeah, very true.
So they're more stressed out than the patient himself. Patient तो is like surrendered कि मेरा जो होगा होगा, मतलब family is going around
To
360
broken
degrees to what all they need to do, what all they can do to make him survive, to give him the comfort, to maintain his quality of life. They don't have the time to think anything else. They're into some like a treadmill of making things smoother and better for the patient. So I think there's somebody external who's the caregiver, or service provider like us. We need to stand by the patient as a friend or a family member. So what I realized that, when patients come to, we do in the smaller nursing homes, as I was saying, that we partner with the small nursing homes, they take their infrastructure, just the bed part of it. I have my own nursing team. They are seasoned nurses. I have retired nurses from Tata Memorial who are working in my team, and they go and give chemotherapy. Okay. So what happens is in the small nursing homes, so these people come 8 a.m. in the morning for, for the chemo
chemo.
to start. And they're there till like 4, 5 p.m. in the
4,
evening.
5 o'clock.
Normally
Yeah.
5-6 घंटे का कीमो रहता है. They don't, I mean, सुबह सुबह उठ के आते हैं. They would possibly have started from their home by 6:30, 7 type. So they've just done their breakfast, or if not, and then they have come here. Now, what I started realizing, I generally go and meet these patients because I don't have so much of volume. So, wherever there are, the patients come, I just go and meet up with these patients, spend some time, speak to them. Uh, and this is a culture I want to build, even like, even when we scale up, hopefully once we do, but I don't want to miss out on this personal touch part of it. And I tell this to my small team that we have. So I go and meet up with them, and then what I realized that for one patient, I was there in that small nursing home that we were doing this chemotherapy in Thane, and I wanted to have a tea. So, and I generally have a housekeeping boy of my office who's also stationed there जब chemo होता है. तो उसको मैंने बोला नीचे से चाय लेके आ जा and bring it for everyone. because the patient was a Muslim patient, उसकी 4 और family members साथ में थे. So he got tea for everyone. और नीचे से टपड़ी से the person came over with a kettle and paper cups, and we gave tea to everyone. Which happened. Then afternoon, थोड़ी देर बाद मुझे realize हुआ यार ये तो मतलब खाएंगे क्या उन्होंने. They have not brought anything for food. And none of these nursing homes, the smaller nursing homes like 30 to 40 bed, they don't have canteen or cafeteria. There's not like a large corporate hospital, right? So then I told my housekeeping boy कि नीचे से ना can you get sandwich for each of them? So he got कितने का खर्चा होगा, 30 रुपए का sandwich आता है. So he got like 4 5 sandwiches packed and then we gave it to them. And that's it. And treatment हुआ, चले गए. After 3 4 months, when I was reworking on my website and I wanted a testimonial, I called up that person that said, "आप testimonial दे पाओगे क्या हमारे website के लिए?" So he said, the testimonial what he said. He didn't spoke about the treatment. He didn't speak anything about the chemotherapy and all. कि सर आपने ना हमें घर जैसा फील कराया. That आपने चाय लाके दिया and खाने का इंतजाम किया. So that is something which touched them. Okay. So that is one thing that I think and which is where what I also wanted to tell you here, that Sanjeevani, which is one of the largest NGO, right, run by Ruby ma'am. She is a great person. I have a
Survivor bureaucrat. Yes,
yeah,
yes.
she's not, she took a voluntary retirement to give full time into
Yes,
her
IRS.
Sanjeev, the NGO for this. She herself is a breast cancer survivor twice. She got and she runs a fantastic, a lot of initiatives. One of it is like, there is a course she has designed where cancer patients go through it. It's a 6 months course run by TISS, Tata Institute of Social Science, and they become cancer coach. So these are
Yes.
cancer patients who have survived and go through that training program and they become a cancer coach. And I am basically talking to them that can I hire these people? So I want to hire 2 3 of these people, because in my model, what I feel that we are assigning a care manager for every patient that we onboard.
Mm.
We are assigning a care manager. So this person is like that friend that I'm talking about. So it's not possible practically to be physically there, but can I handhold this patient throughout the treatment journey? कि कल उसको diagnosis कुछ test कराना है, blood test कराना है, कहीं पे PET CT कराना है. So we have done a tie-up with all this. We have created an ecosystem. And we arrange all of it. Instead of the patient trying to call up 5 different agencies or places, we are in touch with the patient. We arrange all this tie-ups, usko pick up and drop karwana. So we do everything. Okay. But what I'm now doing is that I'm going to hire this cancer coaches who are cancer patients themselves to be this care manager, because where I felt is that these are the people who are the right set of people who can do this in a very very empathetic manner, because they have
Yeah,
themselves gone through the
they're
journey.
good
It
survivors.
is not transactional. I think otherwise it becomes very transactional. So
Transactional. So they can establish that connect there. They can obviously customize how they're speaking to them according to
absolutely.
what they are
And second,
feeling.
you know what, the basic
Yes.
thing missing, the counseling part, which will happen automatically as part of this process. You don't need a
Yeah.
separate MHW or a psycho
Very
counselor,
good.
because somebody who has walked through that road, he's the best counselor. He's
Best
been there,
counselor.
done that.
Yeah. Yeah. No, I think
You,
the great collaborations. Yes, Jayashree ma'am, please add. You were saying
yeah,
something.
as he said, he's talking about Sanjeevani. They have Sanjeevani Life Beyond Cancer. And
Yes.
I met Dr. Ruby in 2019 through another
Mm.
volunteer of ours who works with the railways. And I have given her 2 pairs, and her organization is helping to spread the word of Saaisha in many hospitals in the north, especially in the north. And we have connected with all the coordinators at the hospitals do pass on, because we give bulk supply to all the hospitals in Delhi area. We are giving through Sanjeevani. And there's also another NGO called Doctors for You. They also helped us in
Mm.
spreading the word. That is where we have reached up to the government hospital in Jammu.
Yeah.
We give to the Jammu hospital also. So that, as he says, a couple of these NGOs and some of their coordinators on hospitals are so very, very concerned about patients
Yeah.
that
Yeah.
because I'm not paying them anything for what they are doing for us, but they
Mm.
are doing it even then. No, that is what I really admire and what they are doing, because all our work is voluntary, and it's not their part. It's not a part of their package to work for this, but they are doing it.
Yes. Yes.
So
So
I think that,
Dr.
sorry,
Ruby's
yeah.
no, please, please, Ratul, आप
Okay.
बोलिए.
No, I was also wanting to tell you that, you also brought out that point which we discussed, is that, the waiting period. I think when I was talking to some
And
patient, and these are HNI patients, and they go to some of the
Yes.
large hospital, very well-to-do hospital, and of course they will not come to this local nursing home. They don't have the concern about saving cost and all. But I asked them that, ma'am, what is one problem that you think that you're facing, if you're going to that ABC hospital for treatment? तो शी इज वेटिंग पीरियड है यार वहाँ पे, मतलब वहाँ पे हमें 9 बजे का टाइम दिया जाता है. इफ रीच देयर एट 9 o'clock, then my treatment starts at 10 o'clock. And
Hmm.
once it gets over, after that also billing and all, it takes another 30, 45 minutes to 1 hour by the time I can walk out of it. And then I realized that this is something which possibly, and I was, fortunately, what happened is that I was interviewing some candidates, young guys from MBA in healthcare. There is one guy who gave me this idea that he has done a summer internship in some hospital in Ahmedabad, in fact, and they were working on the zero waiting period concept. And I said, this is fantastic. I heard from him that what is the process, SOP, etc. And it is, pretty much simple and there's no rocket science in it. And I tried that in one of the nursing homes that I have been operating at. And what we did is that as soon as the patient comes, my executive is there standing in the reception, because see, this nursing homes that we operate at, these are not my exclusive nursing homes. So this nursing home will have 100 of other walk-ins. They will not, see my one patient like a VIP, but I want to give that VIP treatment to that patient, right? So my executive is there. So as soon as the patient walks in, we straight away get him to the, the daycare room, and we start the treatment just by signing a consent form. That signing a consent form takes like 5 seconds, and the treatment starts. We don't make her to wait for doing all the other documentation, registration, etc., etc. All that thing, then we do it at the bedside, or patient का family member रहता ही है साथ में. So then we tell him कि sir आप आ जाओ, आप बाकी formality कर लो, and but we don't wait for that to happen to start the treatment. So I think we are able to do it like, patient walks in, and as soon as the patient का treatment खत्म हो जाता है, when the chemo gets
Hmm.
over, there's a 30 to 45 minutes of observation period, right? And there is also some other medication other than chemo which happens at the end of it. So we do the billing at that point of time कि अभी आधा घंटा और है ऑब्जर्वेशन पीरियड, आप बिलिंग खत्म कर लो. Now the nursing home came to me कि सर अगर कुछ और बाद में जरूरत पड़े तो, I said that कुछ और जरूरत पड़े तो I'll pay for it, I'll recover from the patient later, आप बिलिंग क्लोज कर दो. So we are able to do it. So as soon as the patient comes in 5 minutes his treatment starts, and the treatment gets over in 5 minutes, he walks out. So that is what basically we are able to do it.
Yeah, so these are interventions that will make the journey, very seamless for the patient. So
Correct.
I think identifying these pain points and collaborating with the right stakeholders to find solutions is what, is required. And there are certain small steps that are being taken. Now, this brings me to one, point that I would like to ask to all of you, and maybe we can start with you, Dr. Prasad, that the different stakeholders, whether it is the government or it is the NGOs or it is the patient's family members or it is the financial institutions, everyone has a role to play to make this cancer care journey seamless and more, say, quality led, more compassionate for a patient and his family. So, what role do you think the different stakeholders can play? What is it that or the medical fraternity is currently playing? Are there any gaps that can be addressed? This is one parting question that I would like to ask all of you. So, maybe we'll start with Dr. Prasad first.
So yeah, I was listening to the discussion before that was happening, and it was very interesting.
Yes.
One of the main problems in India is, I would say, almost 70 to 80%, of cancer patients fall in that bracket where they are not affording treatment, or they are,
Hmm.
middle, lower middle. Even for a middle class
You're right.
person to take treatment, it is
Very
heavy
expensive.
on them, kind of a
Yes.
thing. It is expensive. Now the thing is, so because of that, there is a very big, elephant in the room as to the cost of treatment versus the quality of treatment that's happening. Many people, so it's like, in my personal practice, I see many people, there is this problem where I come, I counsel them or quote them a certain amount of for the cost of treatment. Somewhere else, someone quotes them even lesser that I will do it in this amount. There's a lot of this kind of thing happening in society. But what people don't understand in that is that, when you try to cut your costs too much, the quality of care that you will be
Quality of
getting
treatment.
is diminished quite a bit. You cannot, people don't understand the fact it's not just doing a surgery and finishing it off. You have to do it keeping certain protocols in mind. You have to do it keeping in certain the quality of life in mind. There are a lot of factors that come into it. And so See, chemotherapy in daycare centers is a beautiful idea. Doing it in nursing homes and all is excellent. But when it comes to surgery and major procedures, it is better to do it in a more
In
equipped
hospitals,
institute rather than trying to do it in
equipments.
nursing homes. This is some things people don't understand. You can do anything anywhere. No one can stop you. But the level of care, if there's a complication, managing those complications, all these things take a very big hit when you try and cut costs too much.
Yeah.
Also, with that, keeping that in mind, I will say that the government is helpful. There are a lot of schemes, there are a lot of trusts, there are a lot of people working ardently towards cancer patients. I get a lot of funding from the state government, for my patients who are genuinely not affording. They give us funds for our treatment. So, what treatment might cost maybe 5 lakhs in a private
Mm.
hospital, we can do that same treatment maybe in 1.5 or 2 lakhs to the patient's pocket. But
Mm.
the thing is, the patient still has to bear that little cost. It's not going to be absolutely free for the patient.
Absolutely true.
You know,
Yes.
people should try and understand that if you're trying to get quality, it does cost a little bit. You have to take that effort from your side as well. We understand that there might be difficulties. You might have this thing. We have to find solutions to those difficulties. So there is a big, disparity in terms of the quality of treatment being offered versus the, cost of treatment versus,
Cost of it.
and because of that, many people are suffering. They don't look at they look at the near future. They don't look at the fact that if they get the right treatment, they will be good for the next 10 years. The costs in future will be much less incurred on them if they take the right treatment at the right time. So many patients, for example, try and cut costs on treatment. They get some complication. They end up spending 10 times more the amount
Ten
on
More.
their
times
treatment.
more.
Yeah.
You know,
Absolutely, doctor. Yeah, this is the
there
long-term cost of treatment that people need to understand. I mean, if something goes wrong, the entire treatment cycle you have to reverse. You go back to the scratch, and which is doing more harm than good
Yeah,
to your body.
exactly. So there is a lot of, so see, the stakeholders and everyone are doing their bit, but many
Right.
times the stakeholders themselves are not aware of the ground realities of things. So there has to be
True.
a collaborative effort in that sense that, see, funds are being given towards cancer patients. There are a lot of trusts helping people out. There are a lot of schemes in the market, which are helping. So there is the facilities, but the problem is, I feel that many times these facilities and this thing are not channelized in the
Not
right
aware.
way that it needs to be done. So it is not only producing a burden on the exchequer like the government, which is giving out funds, but also the right populations of people who need these funds are not
Not
getting
reaching.
these funds because
Not
it
reaching
is
them.
this thing. So from that aspect, I think there is a very big, people have to
Gap.
sit across the table and discuss this. I feel something that there has to be a certain level of care given to the patient, especially in surgery, because I'm a surgical expert. I can talk from surgery point of view, but you cannot compromise the treatment level so much just to cut costs because
Yes.
long term outcomes then are not achieved.
Yes. Yes. Again,
True.
awareness will
True.
play a lot of, a role here wherein people understand and value that how it is a complex disease. So quality is something that has to be, the bottom line of the
Yeah.
treatment so that they can live longer and live better. I think that is very important. Ratul, any parting remarks from you on, the role of the different stakeholders when it comes to, improving cancer care ecosystem in the country, especially from a compassionate point of view?
Yeah, I think, my something which is very close to my heart, and I would, I generally take this opportunity to talk about it. I think that the as Dr. Prasad said, and every one of us knows, government plays a very important role, and of course, I mean today's budget talks about it largely.
Yes.
But I think that the narrative has to change completely. The narrative, if you look at the image in every cigarette packet, if you look at the photograph or video shown in the movie theaters before the start of the movie are extremely horrible and very scary. Okay. And I realized this one thing that, when I was making my website and I was trying to find out the right images, I couldn't find an Indian image which is happy cancer patient image. You search in Google or Shutterstock in any of this platforms for a US cancer patient or abroad, they're all happy faces, smiling, and so it's a very different positive outlook to cancer given in those things. So what I realize is that, we talk about कि अच्छा सिगरेट पीने से कर्क रोग होगा और इसमें, डेथ हो सकता है वगैरह वगैरह. But why the emphasis is not on early detection? Why the emphasis is not on that it is curable if you get detected early? I mean, the messaging itself has to change completely. Okay. I think, and that's where from, what I realize that, if I go to a hospital, you go to any government hospital for that matter, it looks so gloomy. And, as every one of us knows, a cancer patient, what a very important part of it is their mental well-being. They need to be, they need to be pumped up, give a very positive feeling. What I started doing in a very small format is in the daycare that I am running. And, we started with the first one in Bangalore. We have partnered with Hinduja Hospital in Bangalore. And we changed the entire look and feel of the two rooms that we are occupying. We put in nice wallpapers, indoor plants, sofas, etc., uh, made bookshelves, and trying to give it a very like a lounge kind of a feeling and not a hospital feeling. So that once the patient comes and spends 4 hours or 5 hours there, he should not feel that एक hospital में आके मेरा treatment चल रहा है. Of course वो चल ही रहा है, but how can we give him like a slightly different ambience wise, we give him a different feel and make him more positive. So I
Yeah.
think overall, if you can change the narrative of giving it a very positive outlook, starting from the way the government propagates about it, and at a very ground level, the way we deal with the patient, I think things will change for better.
Yeah. No, amazing. I think one key insight is really changing this narrative about cancer. It is not a death sentence. The whole fear mongering piece around cancer. And, like we as communicators, we as advocates, we can also play our part there. Jayashree ma'am, I think you are playing an important part there. You come in, when there is a lot more hope, but still they need to restart their journey and
Yes,
feel
they need to start.
normal as possible. So, any thoughts from you, as parting thoughts that, what could different things play a role?
I would only say that we need to involve everybody in the family, and we need to educate the younger ones that cancer is treatable and it's curable. And we need to say, I mean, I still find a lot of this. The male is the man of the house, and nothing is done without his, that is a cultural and social. We need to change that.
So,
That outlook
damning
has to
that
be changed.
conditioning that has happened, and of
It
course, it
has
will.
to be, that condition has to be, that has been done, and it's very difficult, very difficult. Because even now, suppose I want an email, people tell me, हम email हमारे पास नहीं है, हम कहाँ से करेंगे? I said, you have your son, your daughter, they're all going to school. Now every child has an email account. And then I tell them, they say, नहीं, हम नहीं बात कर सकते. Please call your son, call your daughter. I talk to them. So this is where we have to educate it. And I find it's worse in the northern areas of India than in the southern part. That's my experience. So,
Yes.
and we need to tell everyone, any disease, the entire family is to be involved. It's not just the person who's sick. This
Yeah.
doesn't apply just to cancer, I think to anything. And
To
we have to
anything.
create awareness about this. Yes.
Yeah.
That
No, I
gives you
think.
more empathy, and
Yeah. No,
that's
and
all.
in fact, it aligns very well to the theme that is, for this year, which is, united and unique. So, because we need to understand the unique challenges of the different strata of the society, facing,
Yes.
cancer, and develop strategies, develop, to each his own. So, the whole different patients, different
Yes.
needs narrative comes in here. While the overall
Yes.
narrative around cancer needs to change, it needs to become more positive. Like Dr. Prasad, you also said that the government is doing a lot, and there
Yes.
is and the awareness about that how much technology has improved. The whole
Has improved.
3D modeling, the whole usage of AI. So if we have this awareness out there, I think the narrative can change a lot. So this discussion can go on and on because we have great experts here. But I would say that these are great insights and a very thought-provoking discussion. I would like to extend my heartfelt gratitude to you all for a Saturday, taking out time. But this was important, and
Thank you.
I thoroughly enjoyed the discussion. And I'm sure you all will be connected. Even after this, I can see collaborations and discussions happening, and I think that is one of of the endeavors also while spreading the awareness, while spreading the positive word in cancer care. So I'll take a pause now. Anything that any one of you wants to share? Otherwise, until next time, please take care and stay committed to driving this positive change and helping us spread awareness.
Yes,
Thank
definitely.
you.
This has been a very good meet. I'm very happy for this. Thank you.
Thank you.
Absolutely.
Thank you
Yeah.
so